Hello, I'm Robin Dennison. This is Module 5 of 628, and the topic of this module is Teaching Learning Strategies to Facilitate Critical Thinking. This module is actually an extension of a module that you had in your first nurse educator course related to critical thinking. This module is going to be focused more on teaching learning strategies and evaluation methodology for critical thinking. So the objectives include discuss the significance of critical thinking in nursing education and nursing practice, discuss the interrelationship between critical thinking and clinical decision making, select teaching learning strategies to improve critical thinking skills, to list tools that may be used to evaluate critical thinking skills, and then finally to identify critical thinking behaviors that are amenable to multiple choice items on multiple choice exams. Well, the goal of post-secondary education is to foster critical thinking, and certainly the healthcare professions are focused very much on critical thinking skills and critical thinking capabilities of graduates. Certainly we want graduate nurses to be able to go out in the workforce and be able to look at even a novel situation and be able to come up with a solution that would be best or certainly acceptable. So we have a tremendous focus in nursing education on critical thinking. So why is it important? It prepares individuals to tackle a multitude of challenges that they are likely to face everywhere, right? This isn't just in their workplace, but also in their personal lives, in their functioning as a citizen of a community. It also grooms individuals to become lifelong learners, and we certainly want our graduate nurses to know that they must be lifelong learners. Keep in mind that one of the real functions of critical thinking skills is to be able to take a situation that they've never really seen before and be able to use thoughts and knowledge from previous situations to this new novel situation. We as nurse educators obviously cannot expose students to every possible situation that they might come in contact with in their professional lives. And so certainly that's one of the things that critical thinking, the ability to critically think, does for graduate nurses, is for them to be able to look at a new situation and still come up with the right answer, or at least a right answer. So decision making requires critical thinking, and of course we think about clinical decision making, and it certainly does require critical thinking. It is actually the combination of critical thinking and creative thinking. When we talk about the decision making process, it is quite simply assessment of the situation, to be able to come up with a list of possible alternative actions, and then to pick an alternative action that hopefully is going to result in the best outcome. So that first stage of coming up with, well, the second stage actually, of coming up with those possible solutions is the result of creative thinking, and then critical thinking is what really allows us to hone in on what we feel is the best possible solution. So decision making is that combination of creative and critical thinking. The process, again, of decision making is analysis of the situation, generation of possible solutions, that's your creative step, selection and implementation of the best solution, that's your critical step, and then finally evaluation of the effectiveness of the solution, and then starting the whole process over again, certainly if the outcome was not as desired. So critical thinking is the use of cognitive skills to increase the probability of a desirable outcome. And there are three things that we say about critical thinking. It should be purposeful, of course, it should be reasoned, and it should be goal-directed. And when we're talking about clinical decision-making and the critical thinking that goes with clinical decision-making, that goal direction is certainly toward optimal patient outcomes. So in terms of teaching learning strategies and evaluation methodologies in nursing education, they certainly do need to focus on that critical thinking aspect of clinical decision making. I personally am absolutely fascinated with the creative thinking aspect of that process too. So both of these are very important. So probably the definition, and this is a definition that you heard in your last Nurse Educator course too, because I did teach that module, is this wonderful definition by Paul, and that is the art of thinking about your thinking while you're thinking in order to make your thinking better, more clear, more accurate, and more defensible. A term that we frequently use along with critical thinking is this whole concept of metacognition. And metacognition is what we know about what we know. Sometimes we also think about how we think about what we think. So it really is being reflective, self-reflective in terms of our thinking processes. So what is your role in terms of the development of critical thinking in your students? And remember that when we talk about the teacher these days, you really are the facilitator of learning versus trying to open someone's head and pour the information in. So in essence, what you're trying to do is provide a structure for students to learn. And that learning may be independent, but it may be collaborative. So in this course, of course, we're going to be talking about individual teaching and learning strategies and then group teaching and learning strategies. So we also want to be able to facilitate the development of independent critical thinking abilities. And we also really want to stimulate the drive in our students to seek better and better critical thinking skills. So because we really do want to facilitate this development, then it means that our teaching and learning strategies and our evaluation methods have to be consistent with that goal of independent critical thinking. And we'll talk more about that. So we really want students that are active participants in their learning. And, of course, I talk a lot about active learning strategies. We're going to talk a bit more about that in this webinar. So we want teachers to provide learning opportunities, and learning and understanding only occur because of that student's active involvement. We know that passive learning strategies are not effective in terms of certainly critical thinking. Maybe they can recall information, but really being able to integrate it along with other thoughts and processes, that's not facilitated by passive learning strategies. Active learning strategies involve the learner, and so they are learning through thinking and or doing. So active learning is learning that really assists learners to take part in their own learning, and it does challenge them to take responsibility for their own learning. And depending on how you structure your course or just your particular class session, they may even decide what their goals for learning are. You certainly have objectives for your course, and you want achievement of those objectives, but students may go at that in a different way. We often, in the past, have talked about the sage on the stage, and that was kind of the idea that this learned person, this person that we had so much appreciation for, would basically just kind of sit on the stage or stand on the stage and just fill our brains with knowledge. So we know that that's not possible. You can't just pour information into a learner's brain. But what we want to do is to get away from that sage on the stage, lecturing students to more active learning strategies. So active learning strategies really do shift from the teacher to the learner. So it shifts from teaching to learning. And so the teacher is now a facilitator and, of course, to some degree also a motivator of learning. And, of course, we talked about motivation in our second module. I love this little quote, and that is that the teacher is more similar to a conductor than a soloist, more like a director than an actor giving a soliloquy. And that is the way you really want to think about your learning, your teaching processes. And that is, how do you facilitate learning, rather than just, how do I teach? How do I try to put more in their head? It's not about content, it's about learning. So why am I so fascinated with active learning strategies? And that's because active learning strategies do promote critical thinking that's required for clinical decision making, and especially clinical decision making that is not purely rule-based. And again, what you're trying to do with critical thinking is to be able to prepare this graduate nurse for a situation that they may have never seen before, but they can think it through and they can process it and they can come up with a right answer. So passive learning strategies are things like lecture, especially traditional lecture, again, that sage on the stage. And we'll talk about some ways through this course that you can have what I many times call lecture discussion, and put points in there to make it more interactive and to make it more active learning. Demonstration would be passive. Watching videos, listening to recordings or podcasts, those are passive. And the reason that teachers frequently like those passive learning strategies is because they feel like they can get a lot of material covered in a relatively short period of time. However, we know, of course, just covering it does not necessarily mean that the learner has actually learned that information and integrated it with previous learning and can really use what they've learned. So these are some active learning strategies, and we'll certainly be talking about these as we go through this entire semester. Questioning methodology, sometimes you hear this referred to as Socratic questioning, and we'll talk about that. You have some articles you're going to be reading related to questioning and how to incorporate that into your lecture discussions. Discussion, where you actually ask your students to come to class prepared, like we do for our live seminars, and then you discuss what they've learned about the information. Case studies are great active learning strategies. I know many of you love using case studies and doing case studies. Simulation, you'll get more of that in the next nurse educator course. Problem-based learning we'll be talking about. Storytelling, sometimes referred to as narrative pedagogy, and we'll be talking about that. And also encouraging students to tell their stories and their experiences, or to write them in a reflective journal, or to write exemplars. Critical reading, thinking, speaking, and listening assignments, so that it's not just reading it, information in, but also processing that information and then being able to write about what they learned from it. Again, your self-reflective journals in this course are intended to do that. Love concept maps. Have always loved concept maps. And so we'll be talking more about those. Gaming, again, a way to really get students involved. Web quests, we'll be talking about those. Debate, reflective journaling, again, relates in many of these. And then return demonstration would be active. Self-learning packets and e-learning. Active learning, depending on how they're constructed. Because you all have probably taken courses on a computer or online where you basically just sit there and read the slides. Read the slide, read the slide, read the slide. That's not active learning. But there certainly are active stop points in many of the really good e-learning processes. And then also a process of values clarification. It would be active learning. So how do we teach for critical thinking? We want to promote interaction, not just between you and the student, but between the students. They certainly learn from each other, and learning in a group helps each member achieve more. I think that when you can construct groups where you have strong and weaker students together, it does strengthen everyone. The stronger students benefit from teaching and guiding the weaker students, and the weaker students certainly do advance. You don't want to have a group where you have all strong students where they're just competing for attention and points and grades. You don't want to have groups where you have all weak students, because the product that they're going to produce from that process is not going to be as strong, and therefore everyone's going to suffer. So try to look at your groups and say, I want some variety here. We could talk about, and we will talk about in the group sessions, whether or not you let them self-select their groups or you actually put them in groups. Ask open-ended questions that do not assume the right answer. Remember that the goal of putting questions out there is not to see if they can read your mind and come up with the answer that's in your head, but to actually encourage students to respond creatively. One of the most difficult things for me, and especially online, is to wait for that answer, because you want them to be able to, you want them spinning those wheels in there to come up with possible answers. And if you just answer your own question promptly, then of course they won't do that. They'll just say, well, she's going to tell me here in a minute what she's trying to get me to say. Allow sufficient time to reflect on the questions and the problems posed. I preempted that, didn't I? And then also you want to communicate with the student that the student is expected to be deliberate and ponder, really think about their answers rather than just blurting it out. That's one of the real advantages to using discussion board. You know, a lot of times in class, when you throw out a question, students don't necessarily really think about the answer. They just, you know, blurt it out and give you what they think you want. Whereas on discussion board, you tend to have much more deliberate thought in terms of other people are going to be reading that. You know, I want to make sure my writing and my spelling and my grammar, that they're all good, and so on. Also, you want to teach for transfer, and that is to provide opportunities for students to see how this new skill or knowledge can apply to other situations. And of course, examples and analogies are the best ways for us to do that. So, some teaching approaches that encourage critical thinking kind of set the stage, and that is, this is what we're going to be doing. That is certainly through the use of objectives, and just, you know, if you're going to do an activity, this is what we're going to do. It's also good always to summarize at the end, this is what we did. Encourage reflection, encourage use of a prototype. Like for instance, you know, you can't memorize all the possible non-cardioselective beta blockers, so you may very well say, you know, the prototype that we're going to use for non-cardioselective beta blockers is propranolol, and so on. So a prototype is kind of that exemplar of a group or whatever it is you're talking about. Instruct learners to think ahead to the next step. What comes next? What would you need to know to progress? Encourage thinking aloud and an explanation of their reasoning. I do this a lot of times with test review, and that is, if I have a student that hasn't done well with the test, they want to come in and talk to me about the test, I go through each question with them and say, you know, well, what were you thinking when you read this question? And what made you come up with that answer? Not the right answer, or maybe the right answer. That really helps me to see how they're thinking, but also it helps me work with them in terms of test-taking strategies too, because obviously they have to pass NCLEX. And give them permission to think in an unconventional way. You know, we often talk about outside of the box, and we want students who can be innovative and think outside the box. We don't want to kind of say there's only one right answer. There's a fellow named Van Owick who wrote a couple books that I just love, and I'll remember to bring the citations during the in-class seminar. But one is called A Whack to the Side of the Head, and the other one's called A Kick in the Seat of the Pants. And what he talks about is how to get students to think more creatively. And one of the things he always says is that to get the right answer or answers, you have to ask the question in a different way. And so many times we ask the question and we get these blank looks. So what you want to do then is to rephrase that question to help them think about it in a little different way, and then you're going to get them there. So those are great books. Again, fellow's name is Van Owick, O-E-C-K, and A Whack to the Side of the Head and A Kick in the Seat of the Pants. Great books. Avoid right or wrong, because there certainly, again, is a range of possible solutions. And sometimes students come up with things that aren't even, you know, are wonderful answers that you didn't think about. Focus on key concepts and processes. And then, yes, definitely use analogies. A couple of strategies that are helpful in this whole active learning process and reflection about the content is, this is one method called the muddiest point, and that is either at the beginning or the end of the class, you ask students to write down the points about which they have the most confusion. They should be anonymous, and then what you as the teacher do is you start with clarification of these points during the next session. A 1-minute paper is similar, and that is at the end of the class, you ask students to take 1 or 2 minutes to answer one of the following questions. One is, what was the most important thing you learned today? And then, what are you most curious about? What are you most curious to learn more about? Also, ask students to focus on principles. That is, you've gone through what you feel is important content, and then ask them to identify the key principles that are at the heart of the situation that you've discussed. A little bit about evaluation of critical thinking. These are all different critical thinking tools, and we're not going to talk a lot about these, but I just want you to know that there are nationally standardized critical thinking tools. Certainly when we talk about NCLEX, NCLEX is focused on critical thinking, and that means that we have to prepare students for NCLEX by using evaluation methods that focus on critical thinking. And that means that our exams, our in-class exams, need to focus on critical thinking. So these are some ways that we can evaluate critical thinking. One is to observe students, how they practice in the lab or in the clinical arena. Questioning for critical thinking, that Socratic questioning that we talked about. Why do you think that? And tell me more about your thoughts about this. And like I said, we're going to talk more about questioning. Just having conferences. For instance, your post-conference in particular in the clinical setting is crucially important in your evaluation of students' critical thinking. Problem-solving activities where you give them a problem and say, how would you deal with this? And then I am, as you know, a big proponent of writing assignments. I think that so many times in undergraduate programs we don't do writing assignments because we have large classes and it's really difficult for faculty to grade those writing assignments. But they are very important in terms of critical thinking. Discussion board is one mode of writing assignment that certainly allows you to evaluate students' critical thinking. In terms of evaluation, you communicate to students what you value in what you test. And that is that if you have a test that is just recall, then you are telling students that you value memorization. And I don't think that's what you value. So you need to make sure that you have questions that relate to application. And I'm not saying you can't ever have recall questions. Early on in a semester, you probably are going to have more lower level questions. But later in that semester, and certainly at the end of our curriculums, if we talk about undergraduate or graduate, those questions should be very much predominantly critical thinking. That's what prepares them for NCLEX, for the undergraduate, and what prepares them for certification exams for the graduate. So a lot of times, students will say, is this on the test? If you're really doing application questions, it's very difficult for you to say, this, and this will be on the test. And remember that the test is a reflection of objectives. So make sure that your objectives are at the level that you're going to be testing. And we're going to talk more about that. But certainly when you look at those objectives, the student should be able to look at those objectives and say, yes, 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 I can do this, yes, 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 I'm ready for this exam. Questions on exams should really not be big surprises for students, and they should also not be related to minutia, and we'll talk about that more later too. Testing should match learning, and testing should match objectives. So since critical thinking coincides with Bloom's higher levels, then certainly your evaluation strategies need to reflect on those higher levels. And if you think that critical thinking is important, then you need to evaluate students' ability to analyze and synthesize information by using higher level application type questions. So in your reading assignment, you're reading a chapter in your McDonald book that relates to testing critical thinking. And it's an excellent chapter, and I certainly don't intend to repeat all that chapter here. But keep in mind that as you read that, focus on, she does such a wonderful job of showing you how to convert a recall question to an application level question. Also, evaluation of outcomes. So when we test, especially senior students, we want to know, can they evaluate patient changes, for instance? Best answers. Keep in mind that questions that are difficult, that have high discrimination, are going to be questions where you have multiple right answers, but you're asking the student to identify the best answer. That's critical thinking. Also, critical thinking questions are frequently related to priorities, where you ask the student, what would you do first? And then also putting something on the test that is a novel situation, but relates to another situation that is already covered. So for instance, let's say that you're teaching a class on the immune system, and your question has to do with a transplant patient. And the student may immediately say, darn, wait a minute, we didn't cover transplants. But what you want them to be able to do is critically think about the fact that transplant patient, immunosuppressive drugs, immunocompromise, I know this. I can answer this question. So by presenting those novel situations that are not really novel, not totally novel, but ask the student to transfer knowledge, that's encouraging critical thinking. So that concludes this particular module. We've talked about how you as a teacher can facilitate critical thinking, and how you as a teacher can evaluate critical thinking. And certainly we'll be having, I'm sure, lively discussions in our live seminars. Thank you.